You are listening to part 81 of our series, 7 Medicines, The Wise Woman Way, with Susun Weed at Time Monk Radio. Hello, Susun. Welcome back to Time Monk Radio.
Thank you, Gemini. How have you been?
I have been wonderful. Did you have a good week?
I had a fabulous week. It's such a lush year. I am really enjoying it. And I'm very much enjoying all of this work that we're doing on the 7 medicines. And here we are at the last medicine, at the 7th medicine. I guess we should reassure the listeners that when we come to the end of the 7th medicine, we're not coming to the end of Gemini and Susun Weed. We'll go on to other topics. I know it has been a long run, right? A year and a half, and it's hard to remember that we ever did anything but the 7 medicines topic. But we did lots of topics before. We're going to do lots of topics afterward. But still and all, here we are in high-tech medicine for several months at least, because there's a lot to learn and a lot to talk about and a lot to know. And, unfortunately, a lot of opportunities to partake of high-tech medicine. And when is it there to help us? And when isn't it there to help us? I don't really think it's beside the point. But I was just reading, and I'm sure many other people have as well, in a National Geographic about the Maasai of Africa, indigenous group. They now have cell phones. And they show
Really?
this yes, the Maasai do this gorgeous beadwork. And so this Maasai was wearing this beautifully beaded belt with this gorgeous beaded pouch with the cell phone in it.
Oh, that's interesting.
And they're taking pictures of cows as well as women, because their entire culture revolves around cows. And they're being able to communicate with other people if there's problems with the cows or diseases that come up, and sharing information about crops and weather. And as far as they're concerned, this high tech is not ruining or eroding their culture, it's helping it. So as far as the Maasai are concerned, the technology, the high technology that they have access to now is helping them, helping their culture. And I think that sometimes we look at indigenous people and we have a very strong need to not allow them to change.
Yeah, I can see that.
Certainly, colonization is not good news at all. And the way that colonizing nations have acted toward indigenous people is really terrible. But I was stunned, and I think many of us are, to begin to really acknowledge that, modern technology can help everybody. So here we are, high-tech medicine, the 7th medicine. It's not all bad, but it can be pretty bad. Last month, we really expanded our view of high-tech medicine to include what I call in my book Step 6, break and enter. And the idea that what we're actually doing in this medicine is, in a way, very violent, that we are actually breaking things and entering things. We talked about the use of psychoactive substances and how those break open our minds and enter different things into them. One of the things that I often mention when I'm teaching about this is personal space. If you go into South America, even Central America, it's quite common to see girlfriends or boyfriends walking arm in arm down the street with their arms around each other's waists. And when you are in a conversation with someone there, they would be literally within spitting distance. They're going to be very close to you when they're conversing, whereas in America, we like more space between us. And if you step closer to that person, you're actually breaking in to their personal space. So I think that one of the things that's concerning specifically about that technology is that we can sense and feel and react at the moment. If someone steps into our personal space, we can step back. We can say, "Ooh, don't crowd me." But Madame Curie died of radiation because she didn't really understand what she was handling. Do we really understand what we're handling when we use high-tech diagnosis and when we use technology to supposedly help us find things when they're small? So what we're talking about here are tests, both diagnostic tests and screening tests. A screening test is a test that is given to healthy people to see if we can screen out those who have a certain disease. I'm sure that there are listeners as old as I can remember when you would just come out of the supermarket and parked there in the parking lot would be a shiny mobile X-ray facility, free screening. With the X-ray, you could go in and get a chest X-ray. I can't imagine that would fly nowadays because most people nowadays really understand that every test that you go through that has radiation accumulates in your body, and that you have if you're going to live a long life, that's going to add up. You maybe even remember, Gemini, when you would go to the shoe store and they would X-ray your feet to find out what size.
I don't remember that, no.
Yes, they had little foot X-ray machines at shoe stores for children. And it turns out that children's cells, of course, are very much more easily damaged by radiation than adult cells. So let's start here this week. There are some medical professionals, as well as other people who have gotten together to create a campaign called Choosing Wisely. And this started with the American Board of Internal Medicine, who asked medical societies, including family doctors, oncologists, cardiologists, and others, more than 50, to identify unnecessary tests that were commonly being used. Tests expose us to dangerous side effects: pain, radiation, unnecessary surgery, even death. John Santa, the medical director at Consumer Reports, says that it is very clear that false positive results lead to a spiral of unneeded invasive procedures, medications, radiations, and surgeries. Are you surprised to learn that there's no health organization that suggests a yearly physical? In fact, people who have yearly physicals have not been shown to live longer or healthier lives. The opposite might be true. Staying away from the doctor and staying away from tests can lengthen your life. It's no secret. Tests are overprescribed and overused in modern Western medicine. We're not saying that tests can't be valuable, even life-saving, but what we're saying is if you are told you need this kind of test, think again. Number one, a nuclear stress test or other imaging tests after a heart procedure. Many people who've had a heart bypass, a stent installed, or any other heart procedure feel like they have had a brush with death. So patients push their doctors to reassure them through nuclear stress tests that their hearts are strong. But performing these tests every year or every 2 years in patients without symptoms is not going to result in any change, but it will lead to unnecessary invasive procedures and excess radiation exposure. Number two, this is from the campaign called Choosing Wisely, yearly electrocardiogram or exercise stress test. A survey of about 1,200 people aged 40 to 60 who'd never had heart disease or any symptoms found that 39% had had an EKG, an electrocardiogram, over the previous 5 years, and 12% had had an exercise stress test. The problem? Somebody who's at low risk for heart disease is about 10 times more likely to get a false positive result than to find a true problem. This is going to lead to unnecessary and life-threatening surgeries as catheters are threaded through blood vessels, stents are installed, leading to lifelong necessity to take blood-thinning drugs. The variety of different harms that can come to us from tests, whether those tests are needed or not. We still get those harms, but the harms are especially grave if the test is not really needed. The test itself can harm us through the radiation, or the results of the test can harm us through a false positive. Perhaps the most important thing to remember about any test that you have is if the results of that test are frightening, like you have cancer or you have this terrible thing going on, get a real second opinion. You would be surprised how many times a second pathology report differs from the first one. Tests you probably don't need from the Choosing Wisely campaign number 3, PSA to screen for prostate cancer. The fact of the matter is, PSA tests find slow-growing cancers that don't kill men. The evidence is extremely convincing that in a man with usual risk and no symptoms, the PSA screening test causes more harm than benefit, says Reed Blackwider, president of the American Academy of Family Physicians. As a result of a PSA test, he says, men often have ultrasounds, repeat lab tests, and even biopsies for a problem that isn't there. An estimated 75% of high PSA levels are not connected with cancer. They are false alarms. But when men do have treatment, such as surgery or radiation, between 20 and 40% end up impotent, incontinent, or both. When I was writing my book down there, one of the women who was reading it, her husband picked it up, and he said, well, I want to write my story for Susan because that was his story exactly. A healthy man, no history of prostate cancer in his family. He and his wife were going to go on an extended trip over 2 years where they would have little or no access to modern medicine. And so they both decided to have, a complete physical before doing this. And his doctor said, well, then you need a PSA test. And the PSA test came back elevated. And his doctor said, well, ordinarily, if it was elevated, I would just tell you to repeat the test in 6 months, which is very wise advice. He says, but since you're going to be out of reach of medicine for 2 years, I'm going to suggest a biopsy. And the result of the biopsy, he's now impotent and somewhat incontinent. Oh, and P.S. No, he didn't have cancer. Not all doctors agree that we should avoid routine PSA screening, but most agree that it's overused. Even the American Urological Association, which supports the use of PSA testing, says, really it should only be considered for men between the ages of 55 and 69. The American Society of Clinical Oncology recommends against PSA testing for prostate cancer in men with no symptoms if they are expected to live less than 10 years. And a recent study published in the journal Cancer found that Medicare spent $450 million a year on PSA screenings. The National Preventative Services Health Task Force, a government agency in the United States, recommends against routine PSA screening tests. Again, I want to be clear that there's a difference between a test that we're doing because there are symptoms and we want to follow up and see what's going on, and a routine screening test which is given to a healthy person in the hopes of finding something when it's small. Number 4, a PET scan to diagnose Alzheimer's disease. What I say is the only way to diagnose Alzheimer's is an autopsy. But in the last few years, doctors have begun using PET scans with radioactive dye, which can actually show up the beta amyloid protein found in the brains of people with Alzheimer's. It's very promising for research, but PET scans in older people find beta amyloid in 30 to 40% of people who have no memory problems at all. In other words, about 40% of the people who have beta amyloid plaques in their brain are just fine. They don't actually have Alzheimer's. So beta amyloid plaques are present in all of those who have Alzheimer's, but everybody who has the plaques doesn't have Alzheimer's, or isn't even destined to develop it, says Peter Hershkovitz, president-elect of the Society for Nuclear Medicine and Molecular Imaging. And really, the bottom line is, even if that PET scan can accurately diagnose Alzheimer's, it's still completely untreatable. We have to ask ourselves, what is the information that this test is providing me actually going to do? Is it going to make my life longer? Is it going to make my life better? Is it going to improve the quantity or the quality of my life? And if it isn't, perhaps we are treading upon the kind of curiosity that ultimately killed the cat. Test number 5 from the Choosing Wisely campaign that you might want to just say no to: X-rays, CT scans, and MRI for lower back pain. Lower back pain is so common. It's estimated that 80% of people are going to suffer from some pretty intense back pain at some time in their lives. Excruciating, debilitating back pain. Hey, when it's happening, do you want to know what's happening? Here's the catch. The best imaging machines in the world cannot tell you. Many older people with no back pain, oh my gosh, you should see how terrible their x-rays look. The truth of the matter is that most back pain is going to go away in about a month, and an imaging test is going to lead to expensive procedures that may make your pain far worse. One study found that people who got an MRI during the first month of their back pain were 8 times more likely to have surgery than those who did not get that test, but they did not improve more or over the long run feel better or have less pain. Number 6, yearly pap smears. I know. What? That yearly pap smear, it's like on every woman's health checklist. Go every year and have your pap smear, but it doesn't need to be. In fact, what we now know is that women who are at average ordinary risk only need a pap smear every 3 or 4 years. Cervical cancer is very slow growing, and actually it takes 10 to 20 years for it to develop. If a woman has had a negative test for human papillomavirus, then you really only need a pap smear every 5 years. And if you're older than 65 and you've had normal pap smears, you can just stop altogether. Do note, however, that your yearly visit to your OB/GYN might be a good thing to keep on your list so long as you are willing to say no, 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 and no to all the tests that you might be asked to take as a result of that yearly visit. Just say no to bone density scans for women before the age of 65 and men before the age of 70. Experts say that those who are over 50 who have mild bone loss, osteopenia, testing and drug prescriptions are just a waste of time and money. Not only is the risk of fracture really low, before the ages listed, 65 in women and 70 in men. But medications such as aldrenorate, which is Fosamax, and abandrorate, which is Boniva, have been linked to throat pain, chest pain, difficulty swallowing, heartburn, muscle pain, bone loss in the jaw, and really ugly thigh bone fractures, not across the bone, but up and down in the bone. And there is basically no evidence that if you have osteopenia that you are going to benefit from treatment such as taking a drug. How can these tests hurt us? The tests themselves, in this case, the bone density scan, is a test that uses radiation, so we are harmed by the radiation. The results, which every year the threshold of seems to lower. When we were first using bone density scans, we just said to people, oh, you have severe, osteoporosis. Then the bar was lowered and people started saying, oh, well, you have mild osteoporosis. And then the bar was lowered. And people were told, you have very mild osteoporosis. And then the bar was lowered and you have osteopenia. And now I have women calling me here saying they have pre-osteopenia. Well, we could say that we are all living in a state of pre-osteopenia. As we age, we are certainly going to lose some bone mass, but a bone density screening, I don't think that it's as important as paying attention to getting lots of minerals in your diet so that your bones are healthy. Test number 8 that you probably don't need, a follow-up ultrasound for small ovarian cysts. Many women receive repeated ultrasounds to verify that an ovarian cyst isn't becoming cancerous. But current research says it's really not necessary. For one thing, premenopausal women have harmless ovarian cysts regularly, and even looking for those ovarian cysts with ultrasound can lead to, at the worst, removal of your ovaries. Way before you would be even wanting to consider anything like that, and often without really sufficient reason. The likelihood of a small cyst in the ovary of a premenopausal or postmenopausal woman is very low. About 20% of postmenopausal women have harmless ovarian cysts. Deborah Levine, chair of the American College of Radiology Commission on Ultrasound and a professor of radiology at Harvard Medical School, says that in postmenopausal women, only a cyst larger than 1 centimeter needs a follow-up ultrasound. And for premenopausal women, who typically have ovarian cysts every month, cysts smaller than 3 centimeters aren't even worth mentioning in a radiologist's report. Test number 9 from the Choosing Wisely campaign that you probably don't need, a colonoscopy after the age of 75. Most people should have screening for colon cancer at 50, according to the modern recommendations, and then every 5 to 10 years after that, if the first test is normal. So by age 75, if you've had normal colonoscopies all along, you can give that up. And that's real good news, because colonoscopies can cause serious complications in older people. The preparation for the colonoscopy is exceptionally harsh for older people, says James Godwin, director of the Seeley Center on Aging at the University of Texas Medical Branch, who studies the overuse of colonoscopies. Some older patients become incontinent or experience weeks of pain, diarrhea alternating with constipation. In the worst cases, the colonoscopy perforates the colon. Despite such risks, recent studies have found that substantial numbers of people over 75, even people as old as 85 or 90, are still being told to get a screening colonoscopy. Just say no. to screening tests. Most screening tests will not increase the quality or the quantity of your life. The idea that a screening test is going to find something early is the carrot that is dangled in front of us. But the research often does not back that up. Certainly, if you are at high risk, and that can include living a lifestyle that doesn't promote health, then you might consider the risk worthwhile. But I believe that it's better to really take care of ourselves and take care of our health. And if you're doing that, then 50 different medical professions are suggesting that these are 10 tests that you can wisely say no to. And here's number 10, your yearly physical. Many tests that doctors regularly perform to diagnose anemia or liver disease or urinary tract infections, they don't need to do those unless we really suspect that there's a problem. A healthy person does not need to see a doctor every year, says Jeremy Sussman, an internist for the Veterans Administration and assistant professor at the University of Michigan, who is on the Society of General Internal Medicine's task force for making the Choosing Wisely recommendations. Harvard Women's Health Watch, January 2017, focused their issue on tests that are widely offered for screening but are not advised for generally healthy people and may lead to unnecessary procedures and damage to health. Electrocardiogram, an ECG. In fact, you probably only need an ECG if you think that there might be a problem. Carotid artery screening, ultrasound imaging to detect narrowing of the carotid arteries, which pass through the neck to the brain, has been put forth as a way to predict increased risk of stroke. But the United States Preventative Services Task Force says there's very little evidence to indicate that narrowed carotids increase stroke risk in asymptomatic people, and that test is very likely to lead to additional procedures, including carotid angioplasty, which has a very real risk of complications. Screening for abdominal aortic aneurysms. Okay, it's true. If the wall of your aorta weakens, it can get an aneurysm, which is a bulge and rupture, and you could bleed to death. You could die just like that. And if you've ever been around anybody that it happened to, it is really scary. But to screen healthy people to see if they might have this, especially people who have never smoked, is just not worth it. Other questionable tests that the United States Preventative Services Task Force has been looking into but has yet to issue guidelines for include whole-body CT scans. Many imaging centers, they say, promote full-body CT, which is computed tomography scans, to look for tumors, aneurysms, osteoporosis, hernias, kidney stones, gallstones, but this has not been tested for that purpose. In fact, the National Cancer Institute warns that the most abnormal findings on these tests do not indicate serious health problems, but they will usually lead to biopsies and other follow-up tests that are expensive, inconvenient, uncomfortable, and can be damaging to your health. Whole body CT delivers about 4 times the estimated average dose of natural radiation that you get. So it's not a huge amount of radiation, but once again, remember that radiation adds up. And coronary artery calcium score. A CT scan of the coronary arteries can detect calcium deposits that may signify an increased risk of heart attack. The results of the scan are used to compute a coronary artery calcium score, and The United States Preventative Services Task Force is currently evaluating the use of this score. In the meantime, probably not worth it. Well, I am very appreciative that medical professionals are reaching out to me and that the United States Preventative Services Task Force is there helping me know which screening tests I can wisely say no to. We'll come back next week and talk about medical tests that can cause far more harm than good. Thank you, Gemini.
Thank you, Susan. And this concludes part 81 of our series, The 7 Medicines the Wise Way, with Susan Weed at Time Monk Radio.